I lost my father to cancer. He had been living with diabetes for many years, and he was on insulin medication, which made surgery complicated. In the year as the situation deteriorated, many of you might have had loved ones that you lost to debilitating chronic diseases would know the journey of grief. From denial to anger, sadness to acceptance. Except for us entrepreneurs, we're wired a bit differently. Acceptance, not so much. We ask, why is it done this way? Have you ever noticed hospitals reactively wait for you to be really sick and distressed and expect you to come to them? Have you ever noticed doctors are so siloed by specialization that they look at only one part of you and they don't think about the inevitable depression and anxiety that chronic disease patients are overwhelmed with, which often leads to skipped medication sessions, missed chemos. And have you ever noticed your doctor gets paid whether you actually become healthier or not? So in my journey of building disruptive businesses that tries to challenge the status quo, I've learned we need to apply curiosity to ask, is there a different way of doing things? From building a long-haul airline from scratch, from day one thinking, how do we compete against global giants like Emirates and Singapore Airlines, and growing that team to 2,500 employees and $1 billion of revenue in 6 years. After that, my friends and I started iFlix, an emerging markets video streaming platform. And from day one thinking, how do we compete against a global giant called Netflix? And now again, I thought, let's take on an easier industry, healthcare, which I started with one intern in my living room. And today, we have a team of about 300 across Southeast Asia, serving 1 million employees in the region. I started by assembling a team. My co-founders, Dr. Jeremy Ting, a medical doctor and healthcare systems specialist, and Dr. Tiffany Om, a PhD in psychology, to rethink a different model of healthcare, different from the conventional telehealth models. We focus primarily on the big challenges that no one seems to really address, even though they all acknowledge it exists. From challenge number one, hospitals, whether we call them Healthcare 1.0 or these digital telehealth platforms, let's call them Healthcare 2.0, are reactive and transactional. They wait until you're sick and distressed and expect you to reach out for help. Let's flip that model and build predictive data sets to predict when someone may be sick or distressed in the future and help them when it's early and less costly and complex. Challenge number two, healthcare is so specialized. Your cardiologist only looks at your heart. Your gastroenterologist only looks at your gut. Your dietitian looks at what you eat. Your psychologist may support you with your mental health. But our bodies are not compartmentalized. We need to learn to address mental and physical health together in a coordinated, multidisciplinary, and holistic manner. And third, as I mentioned, what frustrates the payers of healthcare, whether employers, insurance companies, governments, is that medical claims today in Malaysia and around the world are accelerating at double-digit rates, 3 to 4 times the rate of GDP growth, and yet more people are still getting sick. So it's time to reimagine a different model of care. How would we do this? Well, we start by amassing Southeast Asia's largest mental health data set of over 300,000 people to quantify levels of depression, anxiety, and stress by age group, by gender, by business units to identify hotspots and root causes. At the same time, we also collect 4 seemingly simple physical health metrics of weight, HbA1c blood sugar, cholesterol, and blood pressure, so that we can do this at a very low cost. And these 7 combined have very powerful statistical predictive value to predict when someone may be sick or distressed in the future. For corporate clients, we take the next step. What's the value of improving health? What's the value of bringing down someone's depression levels by 17%? Or blood pressure by 20 millimeters of mercury? If we can help quantify the value and demonstrate the return on investment for preventive healthcare programs that address both mental and physical health today, and now working with insurance companies so that we can embed this in existing health insurance products where premiums can be tailored to how much health gets improved, rather than today premiums are solely based on your non-controllable factors of your age or gender or race. How do we deliver digital healthcare in a more accessible and affordable way? Well, we built another app to connect each individual member or an employee to their own multidisciplinary team of psychologists, dietitians, doctors, fitness coaches. We even added executive coaches and financial planners, because the number 1 and number 2 causes of stress, my boss and my credit card. To give them the tools, the support, the problem-solving techniques over an extended period to ensure that their health can be measurably improved. We then use AI tools to supplement and increase the productivity of these healthcare professionals by tenfold. So for example, a psychologist only using a telehealth platform will be maxed out at about 50 to 60 clients per month. Our full-time psychologists serve well over 600. And in markets like Indonesia, where the number of mental health professionals per population is 1/100th that of developed markets like Australia, this allows us to deliver professional care in a much more cost-efficient and accessible manner compared to how it's delivered today. So we also shift care from a reactive model to a predictive model. As we engage people digitally, we're collecting small digital data points from the words that they're typing in their chat conversations with the healthcare professionals, using natural language processing to quantify emotional sentiment, to food journals, taking simple pictures where the AI helps to recognize what that food is, the nutritional content, while a professional dietitian maps that against your specific health goal, to be able to know when is the right time to intervene. On your right-hand side is a chart quantifying the emotional sentiment of an actual 32-year-old female Malaysian engineer. From an early health screening program, she was identified as having early risk factors in that yellow zone. She volunteered to join in the program and start to work with a dietitian and fitness coach to improve her weight. Suddenly, about 2 months into the program, we noticed through these small digital footprints a significant drop in her emotional sentiment score. And at that point, she wasn't reaching out for help. But because she had built a relationship with Darlena, her assigned psychologist, Darlena reached out to her and said, "What's going on? I'm glad you reached out. My husband's been traveling a lot. I'm stuck at home with my kids. The kids are sick. I don't have a support system. It's performance appraisal season at work and my boss is being horribly demanding and unfair. I don't know what else to do. I was thinking of ending my life." She was expressing suicidal ideation, and at the point of distress, her and many other people seemed to not be able to reach out for help. So in all reactive models where you just say, here's a hotline, call if you need help, maybe 1 or 2% of people would. But we know from data sets, 20 to 30% of people are experiencing emotional distress. so we can proactively identify them from early on, engage them, monitor, coach, and guide, and be there to predict those moments of distress, we truly can shift care from that reactive model where we're just passively waiting to a proactive and predictive model with the benefit of technology. So we use digital tools and artificial intelligence to systematize the predictable so that we can humanize the exceptional. Not to replace it with a ChatGPT chatbot, but to enable qualified professionals from psychologists and dietitians and doctors working together as a team, but having the benefit of AI agents to provide decision-making support, case note summarizations, to enable them to support more than 10 times the number of people that they would through conventional means. We believe this is a game-changing technology. We're excited at the potential to go beyond the current 1 million lives that we support, and we hope you'll join us in that journey. Thank you very much.